This morning is from Dr. Jenny Preston, Senior Patient and Public Involvement and Engagement Manager at the University of Liverpool, who's now joining us to discuss PPI approaches with children and young people. Dr. Preston will highlight the lessons learned during her years of experience. Again, Dr. Preston will join us live for a Q&A session afterwards, so please enter your questions in the chat function.
Good morning, everyone, and thank you to the organisers for inviting me to talk today. I'm here to talk about tailoring patient and public involvement approaches with children and young people and some of the lessons we've learned along the way. So, my name is Jenny Preston and I'm Senior Patient and Public Involvement Manager at the University of Liverpool, based at Alderhay Children's Hospital. I was employed in 2005 to deliver a strategy to involve children, young people and families in the design and conduct of paediatric health research in what was then the NIHR Medicines for Children's Research Network. So those who work with children and young people understand that involving them meaningfully requires tailoring practices and methods to suit their needs and requirements, and involving them is complex and multidimensional, requiring consideration of 4 key areas. So the level of participation, so the degrees of power sharing between adults and children, the focus of decision making, so is it individual or is it collective? The model of participation chosen, so is it consultation, collaboration, or is it child-led? And we all need to be clear on, the term that we use when we talk about children, which covers a diverse group of children and young people. I really like the way Mary Kellett describes 4 types of research involving children. So research on children, research about children, research with children and research by children. So this talk predominantly focused on researchers with children as research advisors who advise adult researchers on the doing of research but not actually doing it themselves. And I'll explain a little bit more about this in the next few slides. So my presentation today is focused on a paper that was published this year with my international colleagues who advocate for children and young people's involvement in all stages of the research process. All authors are linked in various capacities to the International Children's Advisory Network and the European Young Persons Advisory Group Network, who work alongside pharmaceutical companies, academic institutions, regulatory agencies, ethics committees and so on. Just to point out that the networks are renowned for working with children through the Forum of Young Persons Advisory Groups and led by the principle that young persons advisory group activities should transform members from research subjects to research partners. The networks also have experiences of working with other ad hoc groups of children and families who are not members of YPAGs from various backgrounds, interests and experiences of childhood illnesses as and when required, and increasingly we are supporting children to become more involved in research as co-investigators or co-researchers. So published principles or quality PPI standards may tell us what we should aspire to. However, they often lack practical details on implementing PPI in practice, especially with children and families. So to share our experiences with the practicalities of involving children and families, we in the research process, we used a patient engagement quality guidance tool as a guide to reflect on the lessons learned from PPI with children and families. The PEQG tool, for short, was developed by the Patient Focused Medicines Development Initiative. So it's a not-for-profit collaborative organisation to benefit patients and health stakeholders by encouraging patient-centred healthcare systems. So using the tool, we chose 11 PPI activities with children and families who were identified by the authors and assessed using the tool. So the activities were purposely chosen to provide a selection of requests received to partner with children and families with regulatory bodies, life science and biotech companies and academic institutions. So 6 of the authors responsible for coordinating and facilitating children and family involvement completed 14 case studies originally and shared with the wider authorship team before agreeing on the final 11 examples. So 3 case studies were excluded as they focused on engagement activities as opposed to focusing on involvement. attention was paid to selecting cases that could represent a variety of activities across different stages of the research process, working with different populations. So the templates that we chose were based on the 7 criterias identified in the tool. So shared purpose, respect and accessibility, representative of stakeholders, roles and responsibilities, and so on. And we asked each of the authors to complete these case studies to be shared and agreed before we actually publish them. So of the 11 activities, 5 fell under the category of research priority setting. So 3 involved children and families throughout all stages of the research process, and 3 fell under the category of dissemination and communication. So the majority of all the case studies involved children only, and various types of involvement were described, such as virtual panel meetings, Delphi surveys, focus groups, study management membership, and consensus meetings. So links to the full 11 case studies can be found in the paper, and I'm now going to focus on some of the key lessons that we learned by completing the tool. So one of the key things that we found, one of the key lessons that we learned was around flexibility. So timing of meetings are often predetermined to suit professional stakeholders, not children and young people themselves, especially if children and young people are invited to join funding panels or panels that are predominantly have adults in the group. And this isn't ideal, and this is most often out of our hands when we're trying to plan these activities, because we just get given, this is an opportunity for young people to get involved, here's the date, here's the time, and so on. So, and most often than not, this clashes with obviously children's school, work, or further education, and they have to take maybe days off without being compensated for that as well. So really about the timing of meetings is really important. So the request for PPI input is received late, so not enough time to recruit the most appropriate children and young people for the tasks, especially of recruiting children and young people with health conditions. This takes so much more time and planning, because if you've already got well-established young persons advisory groups, it's easier to access those type of groups than it is to set up from scratch, because that relationship building is absolutely crucial when you're working with children and young people. Children and young people living with rare diseases may have urgent or unforeseen medical needs that prevent them from travelling to meetings. So you really need to consider alternative ways to involve in children and young people, and those who've been doing this for a long time, had to adapt during COVID-19. But again, that needs really considering when you're working with children with maybe complex health needs. So involving children and young people meaningfully requires more time to build relationships and rapport, like I said. So no matter how much time and effort you put in, that relationship sometimes takes years to develop. So it's really important that time is given to build those relationships with children and young people. And it's not always easy, and it's not always realistic, especially when it comes to including money and staff time to plan all of those activities. But we really should put more time and effort into how we do this and how we plan that. So it won't come as a surprise that diversity is another major issue and lesson learned that we learn all the time. So one of the biggest things that we found is international networks such as the International Children's Advisory Network and the European Young Persons Advisory Group networks tend to attract children, young people and families from high income socio-economic backgrounds within countries across Europe and North America, which more needs to be done to attract children and young people from really included groups. So, black and ethnic minority groups, children from younger age groups, particularly difficult or more time consuming to involve in these type of networks. So it's really important that we put the time and effort into doing our best to reach out to communities and not expecting young people to come to us all the time. But again, that's dependent on time, resources, the project itself, what the PPI ask is. This all impacts on, you know, the diverse representativeness of the young people who get involved. Language is also a big barrier. So lay summaries, for example, were only available in English and not in the native language of some of the young people who got involved in that particular activity. So again, that needs to be considered, and time built into developing it for those who don't have English as their native language. So reaching out to organisations and to clinicians working directly with patients affected by various conditions is really aids the recruitment of patient groups. As I said, it's much easier to involve an already existing group, but it's not always the most suitable, depending on the ask of the research. So, for example, if a researcher came to me looking for children and young people with a particular expertise of maybe, let's say, a condition of, let's say, Duchenne's, then you couldn't go to a young person's advisory group unless it had young people with that condition in the group to inform the practicalities, the protocol. So it really all depends on what the ask is, and we as facilitators are there to help researchers choose or select the best candidates for that activity, because otherwise it's really tokenistic and you're just getting a view from, you know, predominantly healthy children who haven't got that expertise. So one of the final lessons that we learned, one of the biggest lessons that we learned, is that it surrounds evaluation and feedback. So self-reflection, evaluation and feedback mechanisms on the processes and value of PPI need to be embedded into practice right from day one. So as soon as I have a conversation with researchers, I always build in, you know, how we're going to self-reflect on, you know, how the activities went, how we evaluated it, and more importantly, how we're going to feed back what impact the young people have made on the study itself, but also on the, you know, what impact has it had on the young people who get involved. And despite all our efforts, PPI facilitators often struggle to get feedback from researchers about if the outcomes from the activities were implemented, and we need to get better at collecting this, as feedback is a huge motivational factor for why children and families get and stay involved. And despite, like you say, our efforts, so within the Generation R groups that we run from Liverpool, we've built in feedback and evaluation mechanisms, but trying to chase up researchers once the activity is complete, trying to chase researchers up for that feedback is really difficult and time consuming. But we're getting better at it, and we're trying to do. Our young people have suggested that we open up a yearly competition for the best researchers, and they're going to develop a criteria to, you know, assess who, you know, what makes a good researcher. And one of those criterias that the young people have mentioned is that they provide feedback as what happened as a result of their input. So it's really, really important. So some of these lessons might not come as a surprise to people in the audience, but using the tool allowed us as a community to self-reflect on practice and undertake the necessary steps to overcome some of the challenges in future projects. And it's certainly some lessons that I will take on board going forward. And I hope this has been helpful. So thank you for listening, and I'll open it up now to questions. Thank you.
Thanks, Jenny. That really, really interesting presentation, and I love the fact that you've, you know, summarized the key lessons, which is great for us who are, let's say, relatively new to PPI. So I really appreciate that. You've generated lots of questions in the chat, so we'll try and go through some of them. One from Ruth here is: do you have any top tips for researchers who want to build relationships with children?
So obviously that's welcome everyone, and thank you for listening to my talk. Just to clarify, I'm not a doctor yet, so I'm working on that as we speak. But you know, building relationships with children does take time. We had an event last week. We had a training event which was great because we hadn't met our young people for 2.5 years due to COVID. So we designed a training event which we involved other young people who are not part of the Young Persons Advisory Group, and it was very clear that those who've built our relationships up over the years were really confident and really happy to meet us, and those who didn't and were belonging to other groups or not groups really found it, a struggle to work with us, and it just really brought it home to us that the relationship building does take time and effort, and it isn't easy. And as the presenters have already mentioned this morning, it just takes so much time. But I think one of the biggest ways to build relationships as well is if you do go out and reach out to groups and trying to make the research activities fun, which isn't always easy, and especially when you're working with randomized controlled trials, for example. How can you make that fun and easy for young people? And even just research process in general isn't fun. So it's trying to combine it with an activity, short activities, snappy activities, but then also with fun. So, for example, for those who recognise my accent, being from Liverpool, we organised an event last week at Liverpool Football Ground, which was a unique experience for young people, even if they weren't interested in football. But it was just a great way to mix up days with activities, as well as building relationships, having fun, doing something different than research. So that's what I would say is, but again, that all takes time, money and effort, and it's not always so easy. But that's why the YPAG model, for example, is quite a nice model to have, but it's not always the perfect model. So it's just being clear and self-reflecting on that all the time.
Super, super. We have a cluster of questions then around the question of ethics and how do you manage ethics with child participants, and maybe you can talk about that a little bit.
I think so. We have processes in place. So if we want to recruit young people, we would always have an assent consent process in place to, so that young people really truly understand what they're getting involved in. So, for example, the YPAG model has clear procedures in place to cover all of that. And as part of my PhD, which I mentioned in terms of what I'm undertaking at the minute, is I wanted to go down the co-researcher route and invite young peer researchers to collaborate with me and be co-researchers on my PhD. So I had to, because it's part of my PhD, I had to take that to our university ethics committee. And I was quite surprised at the depth of information that the ethics committee wanted, which I felt after 17 years working with children and young people, I had everything covered, and I didn't, according to the ethics committee. So it's really difficult to get it across to people, especially those who don't work with young people, around the issues of assent and consent and the information needs that are required. Or not required in some cases. It's like it's a simple project that doesn't require extensive ethical approval, but to the committee it did, and so it's just covering those issues of what's really required, how do you safeguard against any harms and so on. And I think also using my PPI experience with children and young people is getting the young people to review the information that's going out to the young people, and even then the language that we use is really interesting, that ethics committees can see and be helpful towards, because we live and breathe it all the time. But it's just it is really difficult, but we have procedures in place, and we can share that, and we have tools to share that with people if people are interested in that assent and consent processes.
Great. No, I think that would be really useful. There's a question here about how do we ensure the voice of neurodiverse children are heard in research. Is that something that you've experienced or something that you considered?
Again, I think I think it's based on the individual ask of the PPI. So we get many requests on a daily basis to to involve children and young people. And it's about, working with, as already discussed, if we do get those type of requests in, we work with patient groups, we work with charities, we work with our clinicians to identify, patients within those groups. We haven't come across many people, many activities of that. We haven't been requested to do that. I think people tend to go down those routes themselves and go down directly to charities or patient organisations themselves. So we haven't that experience of that, but it's something that we would link up with if needs be.
Right. And again, there's a kind of cluster of questions about, ensuring that your PPI is representative, and strategies for let's say engaging with those hard to reach people above and beyond just Zoom or Teams or whatever, to engage with them, and even the question about language barriers. How do you manage that across projects that you've been involved in?
It's just to be honest. I mean, I think it's so difficult to be as diverse as possible. And I'll give you an example. So I got a small amount of funding, well, it was a decent amount of funding to work with children and young people in hard to reach areas of Liverpool, to talk about the issue of antibiotic resistance. Now, we teamed up with a local drama group who live in quite a deprived area of Liverpool, who focus in on topical issues, so domestic violence, all sorts of issues, knife crime and so on. So we teamed up with the drama group who co-authored a play about antibiotic resistance, with our research teams, who I was funded as a co-investigator on to deliver meaningful patient and public involvement and engagement. So we got this funding, we got the young people to write the play, and then we got the young people to perform the play in front of 400 young people, primary school age children. But it was so difficult to get these messages across, even through the use of drama, for example, and target deprived areas of Liverpool and get the message across. But that was one of the best projects that we've been involved in. But that took 12 months in the making, even though it was written by young people, and performed by young people. It still wasn't suitable for, larger groups of young people. We reached 400 young people, I should say, and it was one of the most enlightening projects that we've been involved in. And we targeted specifically festivals, groups that already young people went to, and so on. So, but again, it took 12 months to plan. So these projects just take time and effort. But again, I would say work with colleagues in universities who are also, meant to do engagement activities and go out to the communities, science festivals, try and do a lot more outreach than expecting the young people to come to you. Is my biggest point, really.
The kind of interesting theme that runs between this and the first session is just literally the amount of work required and the amount of thought that goes into PPI, that it's not a bolt-on solution to a project. It's a huge amount of work. Do you think that's recognized by funders or by others outside of PPI?
No, definitely not. I don't. I think I suppose this community that we're speaking to today are already bought into and already know the complexities. Like I say, the challenges are that are similar from what we've discussed this morning, and I don't think it is realised. In all honesty, I think we still get last minute requests to. I've received one this morning. Really would love input, but the deadline's tight, as in 2 weeks. So what can you do in 2 weeks? You can't really do anything other than access the existing groups that are not necessarily representative of the ask. So it really is that training element, which was mentioned this morning, is crucial as well, in terms of trying to embed it, into people's minds as soon as they have an idea, as soon as they should be targeting those patient groups themselves, but most people don't know how to do that. So It's about coming to people with the skills to, get that support and say how to. And another big thing is funding, and it was mentioned in the chat about, most of all, this requires a lot of funding in advance. If you wanted to do, realistically, if you wanted to do PPI to inform a grant application, you're looking at 6 to 12 months before the grant application goes in, but there's no funding to do that. So where do people access funding? So again, it's all of that needs to be built into structures to be able to do that. And I'm trying to build on that within our university faculty to say, okay, so where do people go to? First of all, for advice, support, and then provide signposting to funding and other resources to help them do that effectively.
Super, super. Ginny, I think we could talk to you for an hour just to get advice from you, but I think we're on time there. So just again, a sincere thanks to you and to Avril for your time this morning. It's really, really got a lot of interest, and you can see that in the chat. We have a lot of unanswered questions, so apologies for that. So we will close this opening session again.